Each ambularyngel mask comes in its own individual sterile peel pack. Several sizes are available for both children and adults. Choice of size is usually dictated by the patient's weight. Prior to use, make a visual inspection of the device for any damage. Inflate and deflate the device and make sure it is functioning properly. If necessary, press the mask against the flat surface when deflating to eliminate wrinkles and folds on the cuff. The mask should be lubricated on the distal posterior side of the cuff, using, for instance, a sterile water-based lubricant. When the patient is asleep, the head is tilted slightly back and the ambularyngel mask is inserted into the mouth, held at the end of the airway tube. The anatomically correct bend in the tube ensures that the ambularyngel mask glides easily into position without twisting and without having to put tools or fingers in the patient's mouth. There are many other insertion techniques in current use. Please insert the ambularyngel mask according to the specific techniques recommended by your institution. The cuff is now gently inflated so that it forms a seal against the airway wall. The goal is to use as little pressure as possible to avoid trauma, for example, due to ischemia. By ventilating the patient manually while inflating the cuff, it is easy to hear when the airway is properly sealed. Because the ambularyngel mask features an extra thin cuff, it easily conforms to the shape of the wall with exceptionally low intracuff pressure. The ultra-thin pilot balloon on the inflation line provides a precise tactile indication of the degree of inflation. Here, you can see exactly how the ambularyngel mask is positioned in the patient's airway. The patient can now be attached to the ventilator. The clear inspection window in the airway tube allows you to visually monitor the ventilation and see condensation. To remove the ambularyngel mask, simply detach the resuscitator, deflate the cuff, and withdraw the mask. It must now be disposed of.